Hi, in this video I am going to share a couple of commonly asked questions that come in ACE examination. So right off the bat, like whatever comes to my mind, I'm going to recall and I'm just going to discuss over here some commonly asked questions. There will be a lot of questions around postural imbalances. By now I'm sure a lot of you guys already know about this, but just as a reminder, focus a lot on chapter 7, especially the postural deviations, the 5 postural deviations, right? Put a lot of emphasis on the forward head position and the reason why you have the forward head position, that deviation, what muscles are tight and what muscles are weak. Questions may come on that. One more deviation that get asked a lot is shoulder. Of course, shoulder deviations, they'll be asked a lot, especially forward shoulders, forward rounded shoulders. So forward rounded shoulders and medially rotated humerus, right? Medially rotated shoulders. And the reason why, which muscles are tight and which muscles are lengthened because of that. Questions will come around that. Then of course foot pronation, supination, and in the movement screens section of chapter 7, the bend and lift screen is very important. There will be some questions based on that, especially when you're squatting, what happens if your knees are going inside, right? It's called a knee valgus, where the knees are caving in. In that situation, which muscles are suspected to be tight and which muscles are suspected to be weak? The tight muscles are of course the hip adductors, adductors, and the weak muscles are the hip abductors, abductors, which is your glutes. And what's the most commonly seen defect when someone is doing a squat, which is the heels raising up. So if the heels are raising up, which muscles are suspected to be tight? The answer is plantar flexors, the gastrocnemius, and calf muscles. And one more deviation that happens in the bend and lift screen is the lumbar dominance and the quad dominance, right? When a person is squatting, they may start the squat by bending at their knees, right? So if that's the case, which muscles are overactive and which muscles are underactive? Similarly, if there's a lumbar dominance, that is an excessively arched lower back, that's the case when someone is squatting, then which muscles are tight and which muscles require strengthening? So these kind of questions will come. So the answer is your hip flexors are tight, your erector spinae is tight, that's the reason you are having that kind of overly extended arch, and your glutes and hamstrings are probably weak. Also, if you're bending too much forward when you're doing a squat, there are chances that your core is weak, or you should also look for thoracic spine extension. If you're overly extending your thoracic spine, there's a very good chance that you will get into lumbar dominance, that is that excessive arch in the lower back. So these kind of questions will come. Then these tests called the PSL raise, right? The passive straight leg raise. So how much degree of raise is considered good? Like if it doesn't cross 80 degree, that means you're having tight hamstrings, right? That test, the PSL raise test, that's important. And one more thing that's super important is the Thomas test. I still remember when I used to ask a lot of doubt around this particular test. The Thomas test, that's very important. They'll definitely ask you one question from the Thomas test, right? So make sure you by heart that table that is given in the PT manual book. You don't have to by heart, you just need to know those 3 scenarios, right? Where the lower, the lower part of your thigh doesn't touch the bench, and your knee is not flexing to 80 degrees or 70 degrees, something like that. In that case, which muscles are tight, which muscles are weak? These questions will come. So yeah, the PSL raise, the Thomas test, the movement screens, especially the thoracic spine mobility test, the bend and lift test, very important, and the deviations, especially the anterior pelvic tilt, which muscles are tight if you're having an anterior pelvic tilt, which muscles require strengthening, Then yeah, like I discussed, the forward head position and the shoulder deviation. These questions are super important. You'll get like at least 10 to 12 questions around just these topics, because these topics are really important, right? As a personal trainer, these are the first things that you look for in your client while training your client, because the whole concept of ACE is, first you should fix the posture, and first you should make sure that the foundation is good, foundation is strong, and then you build on lifting weights and improving your physique and fitness, performance, and all those things. So function comes first, stability and mobility. So yeah, there were a couple of questions on that part. And the first 5 chapters where you have all those client trainer relationship, there will be a lot of questions from especially scope of practice, right? What you should do as a trainer, what you should not do as a trainer, questions around these. So yeah, scope of practice of a trainer is very important. They'll definitely ask you a lot of things like what should you do if the client is sharing some personal things with you, how should you react to those questions, right? And about keeping certain things confidential, and how should you react in these situations as a personal trainer, what are the things that you're not supposed to do. So more focus on things that you're not supposed to do, because there might be a lot of questions around that, like what you're not supposed to do as a personal trainer. Then there will be questions around the basic emergency procedures that you should do as a personal trainer. Let's say suddenly the client falls unconscious right on the floor. In that case, what is the step that you should take? What is the first step that you should take? What are the 3 things that you should look for, like the ABCs, right? The airway, breathing, circulation, and then you do a head-to-toe assessment. All these things, these questions will come, which is from chapter, I guess chapter 16 or 17, I'm not sure. So I think it's chapter 16. There will be a few questions from there. Those questions get asked a lot. Apart from that, be sure you know the difference between a liability waiver and an informed consent. They try to confuse you a lot. Around questions will come around these, like what's an informed consent and what's liability waiver, and how are they different, and stuff like gross negligence. Which scenario is considered as gross negligence? These questions. And there will be a lot of video questions, guys. Remember, there will be a lot of video questions where they'll show you some kind of an animation, right? And then you'll have to say like what's wrong in this. And don't worry about it. It's going to be easy. It's not that tough. Those video questions, it's actually a good thing. When you see the video, you'll be more clear. And then when they ask you questions around that video, you'll be able to answer those questions, especially if your concepts are good. So that has to do mostly with chapter 7. That's the reason everybody tells you this, right? That make sure that you study chapter 7 like thoroughly. Make sure you don't skip any word of that chapter, right? There's a reason they say that, because a lot of questions is around that chapter. Chapter 8, just know the basics, like what is VT1, like ventilative threshold 1. At what point should you do ventilative threshold test on a client? On which phase do you do these tests? Stuff like that. Step tests. What else? The pro agility test, the performance test, and the definition of power. What exactly power means? It's a rate of speed of force into acceleration, something like that. It's like choosing a moderate weight and doing it really fast. That was one example that about power, which I studied in those chapters. So I think there will be questions around that too. And remember hypertrophy. Hypertrophy is very important, and especially how much rest you should take after doing a hypertrophy training, and how many reps you should do for hypertrophy, and how many reps you should do for strength, and how much the rest intervals, how much rest you should take after when you're training for hypertrophy, and how much rest intervals should you take when you're training for strength. All these questions, because these questions really test your concept, right? It's about how you design a program for a client. So these questions, there will be some questions which will come around these topics. So remember that, study that properly. What else? Informed consent, hypertrophy, emergency procedures. and client trainer relationships, in that what stage a client is in right now, questions around that, preparation stage, contemplation, pre-contemplation, and how do you move a client from this stage to the next stage, questions like that. And risk factors, that's super important. I think it's page 120. I think it was chapter 6, page 120, I'm not sure. There's this table about risk factors, right? There will definitely be at least 1 or 2 questions around that topic, like what are the risk factors. Like if you see these are the factors, like if you see that this person's LDL is super high, like, and his or her age is this, then what's the risk factor, how many risk factors this person has. Questions around these. And from the small book, which is the Essentials of Exercise Science book, there will be very few questions from there, but remember, you should at least make sure that you know the nutrition chapter very well, because there will be at least 2 to 3 questions from that chapter that get asked a lot. The common questions that you get to see a lot in ACE exams is questions around nutrition, especially how much water you should drink before a workout, how much water you should consume during the workout, how much water you should consume after the workout, questions on these topics. And the mathematical problems, there will be some mathematical problems, but they are not very tough. There will be some small questions like how much calories does carbohydrates have, fat have. So if you get a nutrition label, how do you read those, how do you interpret that nutrition label, and based on that sample nutrition label that they'll show you, you'll have to calculate how much calories are coming from fat, or how much percentage of calories is coming from carbohydrates in that entire nutrition label. Questions on these. You may get 1 or 2 questions from the desired body fat calculation. 1 or 2 mathematical problems you might get from there. How to calculate a person's desired body fat, and that body fat percentage. There's that formula, right? Like desired body weight is equal to LBW by 1 minus DBF percentage, where LBW is the lean body weight and DBF percentage is the desired body fat percentage. You may get 1 or 2 problems from there. They may either give you the desired body fat percentage and ask you to calculate the desired body weight, or they might just give you the desired body weight and then ask you to calculate the desired body fat percentage. Don't get confused. I know it's just know that formula and just solve 1 or 2 problems from there, because you may get that problem. Also, the 1 rep max calculation problem you might get. There's this little table. I don't remember exactly which chapter it is. I think, yeah, it's chapter 10, I guess. There's this table where they tell you, like, if you're choosing a particular weight and you're doing 10 repetitions of that weight, then that's equal to 75% of your 1 rep max. So they might say that a client is lifting a 15 kg dumbbell and he's doing it for 10 repetitions, then how much is his 1 rep max, right? These kind of questions you might get. So you have to calculate the 1 rep max from there. So those are pretty much the mathematical type problems that you might get. Yeah, and apart from that, remember the push-up test. In that push-up test, what happens if the lower back completely collapses while doing the push-ups, and or if that person does push-ups with a lumbar lordosis, what muscles are tight, the difference between scapular winging and scapular protraction, because that's a tricky one, because in scapular protraction the serratus anterior muscle is tight, while in scapular winging the serratus anterior muscle is weak. So remember that. That's it. And what else? Also, in scapular protraction, the medial border of the scapula is protruded, while in scapular winging, the medial border as well as the inferior angle of the scapula is protruded. That's it. And what else? Human anatomy, it's obviously you have to study human anatomy, it's very important, but you won't get a lot of questions around human anatomy chapter. But make sure that you know the hip movements and the shoulder movements very well, because the shoulder is like a very complex muscle, right? So that you may get 1 or 2 questions from there, like the shoulder, what are the shoulder girdle muscles, what are the shoulder joint muscles, or questions like pec major and pec minor. So whether pec minor is a shoulder joint muscle or a girdle muscle, these kind of questions you'll get to see a lot in ACE exams in general. So yeah, I'll just give you the answer also. So I mean, to this particular question, which I know, pec minor is a shoulder girdle muscle and pec major is a shoulder joint muscle. So yeah, remember, make sure that your concepts are a little strong on this part, the human anatomy of especially the shoulders and the rotator cuff muscles. There are like SITs, right? SITS, yeah, 4 rotator cuff muscles: supraspinators, infraspinators, teres minor, subscapularis. These muscles and what they do. Like supraspinators is responsible for the first 10 to 15 degree of shoulder abduction, right? And then teres minor and infraspinator is your external rotator muscles. Then you have the subscapularis, which is an internal rotator muscle. Questions like these. You won't get any direct questions, but it's good to know these concepts because they might ask you a question around this particular topic, because the shoulder is a very complex joint, and it's very important that you know all these things as a personal trainer when you're designing a workout or you're dealing with a client who has some kind of a shoulder issue, right? So yeah, remember these. What else? Know about prime movers just a little bit, not much. Like when you're doing a shoulder press, what's your prime mover? When you're doing a bench press, what's your prime mover? When you're doing a leg press, what's your prime mover, right? Like when you're doing a shoulder press, your prime mover is your anterior deltoids. When you're doing a pull-up, your prime mover is your latissimus dorsi. When you're doing a chest press, your prime mover is your pec major. When you're doing a leg press, your prime mover is your quadriceps muscles, right? Those things. And agonist, antagonist, just know a little bit about them, like which muscle is acting as an antagonist. Like for example, let's say you're doing a shoulder press, right? So during the eccentric phase of a shoulder press, you're eccentrically loading your latissimus dorsi, right? So these kind of concepts, don't get scared, you won't get a lot of questions from here, but it's good to know these concepts. They might ask you 1 or 2 questions from here, like just basic questions like what's the prime mover for this particular exercise. And know a little bit about Golgi tendon organ, GTO response. That's important. They might ask you a question like what's the first thing that gets activated, right? Like muscle spindle activation, that's the first thing that happens. That's called reciprocal inhibition. The first thing that happens is the muscle spindle activation, and then when you hold that stretch for a couple of seconds, your Golgi tendon organ gets activated. That particular concept, just know about it a little bit. And what else? Yeah, so these are pretty much the questions that they like to ask a lot in ACE exams. So chapter 7 is important. Chapter 16, emergency procedures, they are important, just a little bit here and there. Chapter 17, those liability waivers and gross negligence, those questions from the nutrition chapter, like I said, how much water you should consume and all those things. The effect of medications on your exercise heart rate, that is important. There won't be a lot of questions, but remember beta blockers and diuretics. These are like very commonly asked questions, like what effect does beta blockers have on your exercise heart rate? When you're exercising, it brings down your heart rate and it also brings down your blood pressure. So what effect does diuretics have? Like if you're consuming if you're dealing with a client who is taking diuretics medications, and what should you be careful while training that person, right? So diuretics basically brings down your blood pressure, but it doesn't have any effect on your exercise heart rate or your maximal heart rate or your resting heart rate. So they might ask a question from that area too. Beta blockers and diuretics, very important. Apart from that, what else? Chapter 1 is important. Chapter 2, yeah, the first 5 chapters, they are very important. You might get a direct question from that table. Like in chapter 5 there will be this table, right? The IFT model, the ACE IFT model, which is like the basic, right? That's the foundation of the entire course, the ACE IFT model, the integrated fitness training model. So they might ask you about that model. You might get a question like, what are the branches of it. The first thing is like oh god, I'm forgetting. I just gave my exam and I can't believe I'm forgetting this. It was the first one was resistance training, functional training, and functional movement and resistance training. That was the first branch of it. And the second one was cardiorespiratory training. So what are the phases in each of these? You should remember this. This should be like, it should be at the back of your head, right? I mean, you should really know this. I know I may sound like a hypocrite because I myself forgot. I know the phases. The phases are like stability and mobility phase, then you have the movement phase, then you have the load training phase, then you have the performance phase. So what does each phase has to do? Just make sure that you have a little bit of clarity on that. What happens in each stage, and when the person is ready for the next stage, these kind of questions might come. Also cardiorespiratory training, there are 4 phases in that also, right? The aerobic base, the aerobic efficiency, the anaerobic endurance, and the anaerobic power. So just know what happens in each of these phases, and at what point the client is ready to go to the next phase and stuff like that. These kind of questions come a lot. What else? Let me think. Yeah, so these are pretty much it. From chapter 10, remember the undulating model and the linear model. That there might be a question from there. Yeah, so basically you have to study the entire book, the personal trainer manual. That's like mandatory. There's no working around it. I skipped chapters 12 and I skipped chapter 12, which was case studies. I didn't read that chapter at all. What else did I skip? I think I also skipped the Tai Chi wala chapter 14. I think it's chapter 13. I skipped that chapter too. I mean, at the end I just skimmed through those chapters. I didn't completely skip these chapters. I read those chapters, but I didn't really put a lot of focus on those chapters. And I was right. I mean, very few questions, like if at all there will be maybe one question from those 2 chapters. In general, you don't get any questions from those chapters. And the special population chapter, I don't think you should study that entire chapter properly, but yeah, you should at least know that as a personal trainer, what is your responsibility if you're working with a client who is having diabetes, or a client who has fibromyalgia or chronic fatigue syndrome. What is the training process that you should take? If someone has arthritis, what kind of what kind of exercise should you give them? If someone has hypertension, what kind of exercise should you avoid for them? Now, these kind of questions you might get. So just know about those things. Like as a personal trainer, what should you do if you're training someone who has diabetes or even cancer? Questions. I didn't get any. I mean, you won't get any questions around that, like specifically on that. But if at all you're studying that chapter 14, special populations, make sure you just know that what is your duty as a personal trainer. So ACE examination, it's mostly about you, right? Like as a personal trainer, how much do you know? So you don't have to really know in depth about that disease, like what happens in cancer and all those things, but you should at least know that if you get a client who is having that kind of illness or that kind of medical condition, what steps should you do as a personal trainer? What exercise modality should you change or modify with that kind of clients? Stuff like these. So that's it, guys. This is pretty much whatever comes to my mind right now about the ACE exam, commonly asked questions in this exam. So yeah, study the chapter. I mean, study that entire book, PT manual. Don't skip it, and try to solve a lot of practice tests. That's the key. That's the main thing. You should do that. If you just do that, if you take a lot of practice tests and if you study that PT manual thoroughly, there's a very good chance that you'll not only clear the exam, but you'll get a really good marks in this particular exam. So yeah, that's pretty much it. That's what comes to my mind right now. So just all the best. Okay, go give the exam and crush it. Bye bye.